often people are dealing with foot pain. There's a lot of different types of foot pain, and we can help you figure out which one you may have. One of the real common ones we see in our office is plantar fasciitis. Maybe it's because we work with a lot of runners, a lot of athletic people, a lot of athletes, but the reality of it is this is happening to everybody. And it's a very common issue, and you typically get a very sharp pain right at the heel. It can be different presentations for that. I'm not gonna be able to run into all those, but I'm gonna go over a few things today to at least help you understand there is a solution or a potential solution to the foot pain that you're having. But again, typically with plantar fasciitis, it's gonna be right at the heel here. There's actually the plantar fascia. It's an inflammation of that, but it runs the span of the entire foot, and you might have heard of something like a heel spur. Someone could have a heel spur and not have pain. Someone could have pain and have plantar fasciitis and not have a heel spur. It's not mutually inclusive there. And so we really want to do a full evaluation, but typically the pain is going to be there. We'll do some things on that area like laser therapy to try to decrease the inflammation. But a lot of the treatment is actually targeting the root cause of it. And for some people, it's going to be really tight calves here. And then that's causing kind of a pulley effect up that way. And then it's pulling the plantar fascia taut. And then it's really tugging at that insertion, causing the pain there. So we really want to check out the calves into the Achilles. We're also going to check the actual plantar fascia itself. And one of the treatments we do a lot is active release technique or Graston technique, which is a stainless steel tool we use to really get in there and release that tightness in that plantar fascia. So we'll do a lot of work into there. We're also going to check the joints of the foot and ankle. We want to make sure that the ankle joint is moving well. We want to make sure the joints within the foot are going well. One of the things we check a lot is big toe extension. Believe it or not, that has a big causative factor to this. We want to know if there's good or inadequate extension in the big toe. There's a joint right here in the first metatarsal. We want a joint play there and see if that's moving well. We need that foot to really be functioning ideally. Some people, like our model here, has got a high arch and that can cause it. Some people have really flat feet and that can cause it. So it's different mechanisms and different things we look at, but either way, both of them can lead to plantar fasciitis. Typically in our office, we're going to be doing a lot of muscle work through this whole lower leg and into the foot. We're going to be doing some joint mobilities and manipulations on there to get some motion there. We're going to give you corrective exercises to do at home, and then we're going to do deep tissue laser therapy right on the spot there to decrease the inflammation to really help with your pain and ultimately your performance. There's a lot of other little activities of daily living things we recommend, like if you have hard floors, don't walk barefooted. There's a lot of little things we teach you during the process of getting you better. But it's a common condition. We see a lot here, and we also do a very good job of treating this with the different techniques that we utilize. So it doesn't have to be surgery, it doesn't have to be injections per se, and you can get back to your full activity levels, typically in 4 to 6 weeks, really depending on how bad it is, how long it's been going on, and different factors we look at. But that's typically a window that we see with someone with moderate to significant plantar fasciitis.